So just a little bit about CQL accreditation. Here you will see our map with little location flags of where we accredit organizations, and we currently accredit more than 350 organizations in 25 different states in the United States. We also accredit the Tennessee IDD system, and also their starting their early intervention system, which we will also be accrediting. And then we also accredit all North and South Dakota organizations, along with several agencies in Canada, Ireland, and New Zealand. So just wanted to chat a little bit about the benefits of accreditation. And we hear all of this information on this slide is really from our partner organizations. These are the things that they have said that really makes accreditation valuable to them. So just a few of the things, one of the items that we hear over and over again is about that external validation, where you're at an organization and you really are doing a great job, and then you ask for that external validation just to have a new set of eyes come in and try to lead you on a path moving forward. It's also that accountability for progress that a lot of agencies appreciate too. So just a few little things about the value and benefits about accreditation. So as Seth said a few minutes ago, if you want to share any tips on accreditation, if you're accredited currently through CQL, please feel free to share those tips in the question and answer box. Again, don't forget that the chat box is disabled, so please enter any of those through the question and answer box. And we will go through those at the end of the webinar in case there is something that we may have missed. So to get us started, we have Jill Westring. So take it away, Jill.
Good morning, everyone. It's a pleasure to be here. We have the 10 tips, and we're going to start with tip number 1, which is attending a CQL workshop. You will see on this slide that there are a number of things, workshops, if you will, quality assurance, accreditation prep, person-centered excellence, or what, as we call it, PCE accreditation, and then person-centered excellence with distinction. These are by no means the only things that we have, but doing all of these, or any of these, it's a real-time, real interactive workshops that we do with this. So we are actually working through some of the accreditation processes. In addition to these, we offer virtual personal outcome measures workshops and hosted workshops that from either you as an organization would host that, or that you will see, or that CQL hosts. And it's knowing that none of these workshops are required, but they can help organizations better understand the whole process that's going on and how we're doing it, and start to develop kind of those enhancement plans even prior to. So again, they're real time, and please check our website, our CQL website, for further information, free recorded webinars, or you can call or email CQL with any questions that you might have. Tip number 2 is to access CQL resources. So that was my little segue from the last one into what CQL has for resources. I just have to tell you, there's so many. It's just a wealth of information on the website. There's an accreditation series that you can watch with your team, your webinar for basic assurances, webinars for personal outcome measures. There's our newsletter, our capstone, lots of data and research, and success stories. And if you go into our website, you can sign up for any or all of these things, and you can take bits and pieces of it, and you'll be able to then access that, and it would just come out with a blast when anything new comes out. The newsletter would come out for all of those things. So again, please visit our website and choose those areas of most interest to you. With that, now Diane will share some of her insights into this area.
Thanks, Jill, and good afternoon, everyone. For community support services, starting this process, it was actually 3 years of making the decision and looking at all the materials. And one of the things we did when we decided to move to CQL was every several weeks, the management team would watch one of the factor seminars so that we could watch it together, and then we would have a conversation about where our organization was in relationship to each factor. So that helped us have a lot of stakeholders at the leadership team level in order to, as we move along into the accreditation process, making sure we had all the internal stakeholders in place. And it's a very good process, and the factor seminars really explain what CQL process is.
Thank you, Diane. Our tip number 3 is to connect with other agencies. Again, please partner with those organizations that are already accredited. They can give you valuable information on how this goes and how the process works, and that we're all here for a win-win, that we are not here to judge or to do any of those things. It is to help organizations find their way into their enhancement process. Next slide, please.
Oh, wait, Jill, I can add a comment.
Go ahead. Yes, please.
Once community support services decided with CQL, part of the process is we talked to one organization who had been accredited for many years to get their input, and then an organization that was newly accredited and to get their experience as a new accredited organization. And I'll just emphasize what Jill, everyone said it was a very positive experience. It was a growth opportunity for agencies, and that's what really helped us make the decision to move to CQL, was other organizations and their input and impact.
And thank you. And you can find those again on our website of the organizations that are already accredited, so that you can find them in your area and be able to contact them. Most organizations that are affiliated and partnering with CQL are very open to coming in to observe some of the things that are going on. The POM workshop, of course, is invitation, or that you sign up for that. So please take a look at that. Diane, was there anything else you wanted to add here?
I would just, really emphasize talking to other organizations who have been part of CQL. Their experience is much different than other accrediting bodies that we've been part of. And I think it really reassured my leadership team that it was the right direction to go. So I would just strongly encourage reaching out to other CQL accredited organizations.
And the last point on here, to join CQL's Facebook e-community, there are lots of things that go on in there, so that you can put your question out there, and then you have just this world of people that have already been through it, or might have an answer, or might help you find a direction that you're going, additional resources, and it just goes on and on. So please join us on our e-community. Thank you.
Hello. One of the other things that we recommend is, once you engage with CQL, we send you our accreditation manuals. And at a minimum, those include just 2 of our manuals, but we'll get into those in just a minute. Susan Arwood from Core Services of Northeast Tennessee really got into reading the manuals that we had sent and really gearing up for accreditation, and continues to use those tools for her quality enhancement. great organization there in Tennessee. And Susan is delighted to talk to anyone. So there's just a little plug for someone an agency that you can connect with. So, you know, when reviewing our manuals, they're fairly simple. We send at minimum the basic assurances manual because that is the foundation for every type of accreditation that we do. And then we also send the personal outcome measures manuals, and depending on the types of services that you receive, you would either receive the adult personal outcome measure manual or the children and youth personal outcome measure manual, or both if you provide both of those services. So when you're going through the manual, especially with the basic assurances and the POM, you know, really pay attention on how to gather the information to answer your self-assessment. And when we talk about policies, procedures, practices, what we mean there are the way you do things and how your agency is guided. So we look at, you know, from previous webinars, you know, that we look at both systems and practice. So the systems can include pretty much anything that's in writing. So policies, procedures, you know, we take a look at forms, we take a look at handbooks, we take a look at different assessments an agency might do. All of those are systems. And then after looking at the systems, we also look at the practices, which is basically how the system is implemented. And we gather that information through the practice information through focus groups and conversations with people, obviously through the personal outcome measures, talking to organizational leadership at all levels, and visiting with people where they receive services. So we spend a lot of time with people. And, you know, in my opinion, this is one of the things that is very different than other accrediting bodies. It's very important to us to spend time with people. So as you review the manual, we also would encourage you to reach out to your lead if you have any questions about any of the probes or anything like that within the basic assurances, or if you have any questions about the personal outcome measures, and that staff will be happy to help you. So we're going to talk for just a minute about developing factor teams as you are reviewing the manuals and the accreditation materials as you're getting ready to do that. Kristen Salkis from New Star did this. They created teams, and quite a few agencies actually do this, where they created teams to focus on gathering information about the basic assurances. And, you know, they really do, those teams can really support an organization to have a different perspective. So some of the things that we recommend about factor teams is the impact that those teams can have on you. So, you know, it definitely is a positive culture shift. And when prior to coming to CQL, I worked for an agency that was accredited by CQL. And this is one of the things that we were lucky enough to do. We were able to create factor teams and to you know, talk about the basic assurances and, you know, how we were implementing them or how we were not implementing them. And we want to make sure that the entire agency owns the process of accreditation, that it's not just one person who is filling out the assessment, gathering all the information, things like that, because what we have seen time and time again, unfortunately, is when an organization does that, if that person leaves, you know, because they won the lottery or decided to retire or something like that, all that information can be lost. We also recognize that some of the agencies that we partner with are very, very small. And it may fall on, kind of one person's shoulders to lead the project. But the more you can bring in the staff that are working direct support and people receiving services, I mean, don't forget to have people with all different kinds of knowledge working on your factor teams if that's what you decide to do. It's really important to have different perspectives, because if you're only going with, maybe your quality enhancement director or your quality enhancement staff, if you're only going with their perspective, that might be very, very different than maybe your finance staff or your HR staff, and certainly will have a different perspective for people receiving services and then the staff actually providing the services. So definitely, keep this in the back of your mind, and we'd be happy to give you some opinions and some directions around how you can go about those factor teams, especially when you work for a very small organization where it might be a little more difficult. And Diane, I think that you've had some experience with this, so if you want to chat a second about what you experienced, that'd be great.
Thanks, Kate. We're a mid organization, so for us, we were able to create all the factor teams because, quite honestly, looking at the self-assessment the first time is extremely overwhelming. And so breaking it down by factor and different teams was very helpful. And then each team, they were looking at one factor. I chose not to be part of most factor teams because I wanted input at all levels of the organization. So we truly had people from the top down, and finance to HR, facilities was involved. So each factor, we had a different group of people to get that true input and true, not just my perspective of what was happening at the organization, but really as a whole organization, what everybody's input was. And then it wasn't as overwhelming coming back and each team presenting and doing the self-assessment. So I would strongly recommend that if you have the amount of staff at the organization. And I will say, these ladies were great when we had questions all throughout the process, accessible email, accessible setting up phone calls. And I just encourage people to use them because they were very helpful in walking us through the process. So we felt confident when the survey came.
Thanks for that, Diane. One other thing about having teams work on each of the factors is that you might want to mix it up a bit. Of course, you want subject matter experts, so you would want people who do training and human resources or help with, health issues or safety issues, things like that. Of course, you want those on the appropriate factors, but also think about maybe putting, a finance person on the rights factor group, as well as, factor 9, which would deal with finances, just because of that different perspective that that person may have. And, maybe somebody from human resources or training, have them work on dignity and respect, or, just to give yourselves just more information on how they perceive things. It's if you decide to go forward with factor groups, it's such a great learning experience, for other people on the teams. And so many light bulbs go off, and the feedback is just very, very important. So it certainly helps shift the culture of the organization too, I think, to take a more appreciative inquiry approach, which, of course, we want everyone to do. So our next tip is around gathering documents and evidence. To me, this is kind of the fun part. So our good friend Mark at St. Louis ARC, they have been with us for a really, really long time. He says that, you know, just looking at all the different information that they had and that they've been able to, the perspectives they've been able to hear from, they've been able to really set some very strategic priorities to continue on their quality journey. So this kind of evidence, information gathering that we're going to chat about is really key. So one of the things that we like to do is listen to stories that help evidence practices. So for instance, if you're trying to find evidence on dignity and respect, you know, yes, we're going to want to look at, you know, grievances or complaints, things like that. But we also want to hear some really great stories about from and about people receiving services where maybe, you know, they didn't feel respected for some reason, and then the agency started to shift and really listen, and so that person now, you know, really feels listened to and valued. You know, just stories like that. You also will receive an accreditation prep checklist, which gives you some of the documents that we want to look at. And throughout the course of your accreditation, in your accreditation week, there will be other documents that we want to see. So it's not just that list. It's, of course, other things that we also may want to take a peek at during your accreditation week. We want to also make sure that any of the evidence that you have is accessible to the team members, because the not just the CQL accreditation team members, but your internal team members too, because they may need to reference different things for different factors that kind of, you know, the factors that may influence others. We highly recommend spending time with people where they receive services to take a look at those practices, because you may, you know, if you're not able to, especially now during a pandemic, you know, not able to get out to the places very often where people receive services, there are still ways to connect. Obviously, you know, Zoom and Teams and all kinds of other things that you could do to connect with people, but really spend time, because what you may assume may not be what is actually happening. And I'm not saying to creep on people or anything like that. I'm just saying hang out and talk to people and spend time with people to really just see how things are really going. The other thing that we really, really cannot stress enough is we do not expect perfection. We expect progress. So if, as you're going through your self-assessment, as you're preparing for our visit, please do not rush out to create something that just isn't there. Let us help you do that. You know, especially with first-time organizations first going through the process, we don't want you to create a bunch of policies that may not end up working for you. So, you know, if it says there's a policy, you know, if one of the basic assurances says, you know, the agency has a policy in place that blah, blah, blah. If you don't have that policy, just say that. We do not currently have this policy. And our, you know, another of our roles is to help you find some resources and give you some ideas on some of those policies. We do not prescribe what agencies have to do. We don't have a bunch of templates that says, here, this is your new Human Rights Committee policy, because there has to be ownership there. And every organization is different, and every organization has different perspectives and different ways of doing things. So, and obviously, you know, regulations do play a bit of a role in that. So be sure not to, you know, pretty pretty quick, put a policy in place, and that way it's there, and so it's marked present. For one, we can tell. Okay, if a policy is not fully implemented yet, and it is okay, however, as you're looking at your policies and your different systems, that if you need to tweak something, just be transparent about it. That's really what we want. And again, we will need additional evidence or documents that we will ask for during the accreditation. Diane, do you want to share how your team gathered the different types of evidence?
Yeah, I mean, I want people to really take to heart what Kate said, because we really listened to not gathering policies and procedures and writing policies and procedures that we didn't have in place. We really took a serious look at our policies and procedures and made sure we, had them all earmarked, and the documentation process is easy. We had a joint space where everything was uploaded and CQL could look at it and staff had access to it. But we did not put things in place we didn't have. What we did a few times were things that we already knew we wanted to do. And we were like, okay, we wanted to increase our staff trainings on abuse and neglect. So we started to enhance that and started training programs. So that was one thing we did new, but it was in the docket. But a lot of things I just can't emphasize enough, we were very transparent and with Kate and Jill. And I think that was just really helpful to us on making the next steps for the organization on where we wanted to go in each area. So the documentation was important, but also not, we didn't fudge anything. We were really honest and made changes. So I just encourage people to really take to heart what Kate said.
And that is so important, Diane. That transparency piece really means a lot. I mean, it's a partnership. We've talked about this in previous webinars. And, again, we're not coming to you to beat you up. We're coming to you to support you to move forward. So the more transparent you can be, the better it is for everyone, I think. So now I believe we are moving on to Elizabeth, if you want to start chatting about factor 7, or not factor 7, number 7.
Thank you, Kate. Absolutely. Diane and Kate have already been talking a little bit about policy. So our tip number 7 really is around reviewing how your policies and practices align with each other. And, here's another nice quote from a CQL partner that, accreditation is this strong foundation that supports the agency to have clear and solid policies and practices over the past 14 years. There's several things that are important here. Number one, like they said, don't just copy basic assurances probes and paste them into a policy. It's not about that. Yes, in the probes, we are looking for specific elements in policy, but we're not looking for that direct cut and paste. We're looking for description. We're looking for how that specific area really applies to your organization. So we recommend that you don't just simply do a copy and paste wherever our, a probe may say, is this in policy? Another thing, like we talked about, ask other accredited agencies or CQL for examples. We may have examples of a nicely written policy that we may be able to share with you, or there may be another accredited organization that you can ask for to take a look at their policy and how they kind of met this area, whatever area it may be. What we're always going to ask you, though, that is if we do share a policy, don't just take it, slap your logo on it, and call it your policy, because we're really sharing just an example to get you started, because we know how difficult it can be to start policies from scratch if you are starting from scratch. It's important to do observations. A lot of times we may hear that our policy says this and that's the way it should be happening. And that's kind of a flag right there. We want to really make sure that policies and practices are lining up. So if your practice has outgrown your policy, there has to be that system to go back and update the policy to reflect that current practice. And so getting out there, doing observations, meeting with people, talking to people, direct support staff, supervisors, people receiving services, look at what's going on, especially regarding safety, dignity, and respect. And then, of course, like Diana had said, critically examine your policies. When was the last time a policy was reviewed? You're looking at it for relevance. You're looking at it for accuracy. Again, matching what's happening within the organization. And you're also looking at, is this policy written in a respectful manner? Is it person-centered? Is the language, respectful language? Is it solely based on regulation and really doesn't speak to the person as a person? So really take a look at those policies and examine those to ensure that they match up with current practice. And Diane, I know you have some experience here. Would you share?
Yeah, thanks, Liz. The one thing as you were talking, I know there was, as the teams were looking at policies and procedures, we certainly came across some that were not practiced. So, kind of antiquated, things on rights that we weren't practicing. So the policy wasn't matching the reality of what we were doing. And what we were doing was right. The policy was old. So, we definitely found some of those inconsistencies. And I think since we had program staff from across the agency, we found between programs inconsistencies in following the same policy. So that was one of the things when we found that out, we're in the process of correcting some of those policies. So that was a really good learning experience for us and team members and program staff who have really taken the leadership role in looking at those policies. So it was a good experience.
Fantastic. Thank you, Diane. Tip number 8 is keep in contact. We cannot stress enough at CQL how we are partners. We don't go in and survey. We come to you, you come to us as a partnership to really provide, the highest quality practices. And the ARC of Cape May County noted that, we are confident that CQL's leadership team will always point us in the right direction and be transparent and truthful with us. And that is exactly what we will do. And that's exactly what we expect from our partnering organizations. So as far as keeping in contact, again, it's a partnership. Reach out with your questions. We often say we're not lawyers. We don't charge by the hour or by the email. So give us a call, send us an email, reach out with any question that you may have. Also, feel free, as you're preparing for accreditation, schedule additional meetings with us. Sometimes that email, maybe doesn't answer the question. Maybe it just needs to be talked out. And so, again, that can be a phone call. It can be setting up a virtual meeting, a Zoom meeting, Teams meeting of some sort. But schedule additional meetings as you and your organization feel that you need. That's what we are here for. Always provide us with updates about changes at your organization. This is really, really important. It's important that we're aware of any leadership changes, any changes in who our contact person is. We need to know how to be able to stay in touch and how to reach out to the organization. Also, if you add any new services or you discontinue any type of services, it's good to know those things, as well as any celebrations. If there's anything that you're proud of as an organization, something was in the paper, in your own newsletter, something you celebrated, we love to hear those things as well. So please reach out and let us know those things. If anything is confusing, do not try to figure it out on your own. There may be some things that you are able to, such as maybe just a question in our portal system, but there may be some things that are a little bit harder to try to figure out on your own and to really ensure that you're understanding it clearly. So please request clarification on anything that may be confusing. And that could be anything around the basic assurances, completing the self-assessment and portal, the schedule, all those things that we've talked about in all of our tips up to this point. Any help that you need, we're here for. And then lastly, of course, stay in touch with your quality enhancement specialist. You have an assigned quality enhancement specialist that is your lead for your accreditation. And our role is to guide you through this process with the least amount of stress that you can possibly have. Not saying that always works, but we're really here to help guide you and really make things fun. So Diane, anything to share here?
Well, and I would agree with everything Liz said. CQL was very accessible, and we probably had 2 meetings prior to deciding to pursue CQL, and had another meeting with leadership team, and then lots of emails and lots of phone calls. And I still reach out to Liz because we're working on some revised outcomes, and always has been accessible. I have never felt silly or stupid of asking any question and get immediate feedback. So it really, don't be afraid to ask questions. Don't be afraid to be transparent. Everything is to lead you as a leader and your agency to be a better organization, to provide best practices to the clientele you serve. And so I just cannot emphasize enough, they're extremely accessible and very supportive.
Thank you, Diane. Tip number 9 is about bringing in a variety of stakeholders into the process. Trinity Services shared that staff from all levels of the organization, as well as people supported, participated in the basic assurances factor committees that met at least monthly. And this is something that Kate and Diane talked about already, is just about getting people involved in those factor meetings, those factor groups. If you're able to have those kinds of meetings, have those kinds of teams. What we're talking about here is really around, as we get into the schedule for the week as well, there's focus groups that we like to hold. And because this isn't just about policy, this is about people and outcomes. And so we always hold a number of focus groups. And so it's important that you talk with people and identify people that would like to be involved in those focus groups. It can be, we have a focus group for people receiving services, for direct support staff, for direct support supervisors. Depending on the types of services, there may be family focus groups. It may be focus groups that are service specific. There's all different types of focus groups that we may have, and that's something that's agreed upon by CQL and the organization as you're doing your schedule planning. But this is important to bring in different perspectives about the organization and the services. So, identifying other stakeholders, like I said, to provide different perspectives. Typically during the week, there's an opening kind of presentation where the organization can really show off to CQL who they are and what they do and the great things that are going on. It's a great time to have all kinds of different people attend and provide input, not just the leadership team, but all kinds of different people, families, people receiving services, community members, direct support staff, other management team members. It's a great time for everybody to come together and celebrate. Another example may be if you have a family member or a community member that's involved with your human rights committee. What a great person to bring in, say, to Factor 1, which is rights protection and promotion. And during that group, be able to share their perspective on rights protection and promotion within the organization. as you're putting together focus groups, consider tenure for any of your staff focus groups. A person that's only been there for 6 months can give a very different perspective than someone that's been there 20 years. They're both very valuable, and we want to hear from people that have been there, brand new all the way to very tenured staff. Same with different services and programs. So with staff and people receiving services, we want to hear from those people that receive different types of services and that provide different types of services. If your services are focused in one key area within the organization, then looking at different programs and not just everybody maybe from one home or one day program, but people from spread across from different parts of the organization. Very important to have a very holistic perspective of what is going on at the organization. And of course, don't stack the group with only people who are positive. While these people are great and we love to hear from them, we can tell, honestly, when groups have been stacked, because these aren't the only times we're having conversations with people. We're having conversations during visits to people's homes, during visits to day programs and other locations. We're talking to people all the time. So it's good when you are putting together those focus groups that people are going to be there that, maybe have some criticisms or maybe have some other things to share and aren't always just going to be glowing about the organization. And of course, the very last tip, which I think is the most important tip, have fun. I know this is a stressful process. I personally have been through it before on the provider side, and I understand very much so that it's stressful, but it really is about having fun. And, as Emily at Total Link to Community has said, we are so thankful to the opportunity to partner with CQL to celebrate our successes, because that's what we like to do. We take fun very seriously. It is very important. We want organizations to show off their successes. No matter how small they may seem, they're important, and it's what's meaningful to you as an organization, what you're proud of. We want to celebrate with you on those things. So show those off. It's important. We're not only there to learn about, what the opportunities are, but we're also there to learn about what you're proud of and what you're doing really, really well. Those things are just as important, if not more important. Don't make anything that you do at any point in time in your relationship with CQL, prepping for accreditation or during accreditation, don't make it just a show. It should really reflect any presentations, any conversations, any interactions should really reflect who you are as an organization and your culture. Don't make it a show. Again, it's one of those things where we can tell. We're looking for transparency. We're looking for authenticity. We want you to be open and honest, again, about your strengths, about your opportunities, about what you're good at, what you want to get better at, and what it is that you are looking for from CQL. What is it that you need from the partnership that you are embarking on with the Council on Quality and Leadership? So, of course, this is the most important one. So this is the one that we end on as far as the actual tips. But Kate is going to take us through a few other slides with some things that are upcoming.
Well, thank you, Elizabeth. I appreciate it. So our next accreditation webinar is we're going to be talking November 9th about how we actually, for those of you who haven't been through one, how we actually conduct a virtual accreditation. We'll give you some ideas and some pointers and just some, some tips on how to make it through a virtual accreditation. We do not know how long we will not be traveling. Obviously, our highest priority is to ensure that people are healthy, including people at your organization and also our staff. So just to let you know, a few other places to find us. You know, Jill had mentioned our eCommunity page on Facebook. We also post if stories about organizations. We post research. We post happy things that are going on, you know, in different places. We'll occasionally post on legislation. You know, there's all kinds of things that we do there. You know, we're also on Twitter, and our website is full of information. We have a YouTube channel that we post things on, and you know, all kinds of other media. So we do have a lot of free resources. And if you guys, if any of you have any questions or ideas or comments, you know, please feel free to post those in the question and answer box, and we'll take a look at those. We also want you to, you know, as we have all stated, we all want you to, you know, connect with us. We want you to contact us if you have questions, if you have comments, if you want to make a suggestion. We would love to hear ideas that you have for upcoming webinars. This series of webinars is certainly in response to organizations' requests. We also have, you know, the series regarding the basic assurances, and then a lot of webinars around the personal outcome measures. So, you know, I think one thing organizations also ask us a lot about is how we do often get how we can make sure that the accreditation experience is really kind of designed for the organization. And there are some basic things that we do that are just, we do with every organization. However, we also recognize that every organization is different. And, you know, some agencies only provide a very narrow line of services, and some agencies certainly provide services to a variety of different people. And we work with both, and we want to make sure that the accreditation experience is meaningful, and that it is it helps you make your progress on your quality journey. So, you know, feel free when you're talking to your lead, you know, if you want them to, you know, as Liz has said earlier, if you want them to do an additional focus group, or you know, ask maybe some different types of questions for during a DSP focus group, or a focus group with case managers, or, you know, anything like that. We're typically very amenable to that. However, it's important for us to get the other things that we need done also. Diane, do you care to add anything else about your experience?
I would certainly say that was the advice you gave us, to have some fun with it and to be, again, transparent and accessible. We did it virtually, so without the training, that would have been nice to have before. Virtually, it went very smoothly considering times we're in. I think Jill and Liz were able to see stakeholder groups and you know, meet lots of our staff and everything very successfully. And you know, it's still There is stress because it's, we're concerned about the process, but ultimately it was a great experience. Staff really enjoyed being part of it at all levels. And again, throughout the process, I thought Jill and Liz were very accommodating, very accessible. And a couple times when we were concerned about something, helped talk us down and, explain that, it's all a process. So I just want to assure people it is not as stressful as we want to think it is. And that it just was a really rewarding experience for the organization.
And one thing that I'd like to add on to that, in just very specifically in the case of CSS, which is Diane's organization, is they were very transparent and very open on the areas that, were opportunities. And while filling out their basic assurances self-assessment, which is a requirement of all levels of accreditation, they would mark a no in areas that were not present and would even note as a comment, we need help in this area. We could use some advice in this area. And, because we have that information, at least a month in advance of the accreditation visit, that gave Jill and I really some time to sit down and say, okay, well, what can we get together and what resources do we already have? So it prepared us then as well to know how to very specifically respond to what their need is, and we could talk it out and have those resources ready when we got into that week. So I cannot stress enough how important it is to be completely honest on that self-assessment and mark it as an opportunity. It is okay. Marking something an opportunity is not going to just mean that you're not going to be accredited. If you mark it no, it's where we know that we need to find ways to be able to support you as an organization. And that was extremely helpful as well.
I think there were a couple of those, Diane, if I remember correctly, that you all had marked no, and we actually found that you were okay. It was there. We just, we needed to dig a little different in different ways. So.
Right. I think the important thing is the conversations we had around it. And so the conversations help staff understand and give us guidance. And yeah, there were some things we're like, oh, that's great. That's what that means, because it was our first time. So it was a new experience for us.
Yeah.
Yeah, absolutely. Yeah. That's an excellent point. Yeah, it's the interpretation. Sometimes you don't have that full understanding of a probe or an indicator, an area, until you're actually able to sit down during that accreditation and have those conversations, with the CQL staff. And so again, it's a learning process even during that week. So that was a great point, Jill and Diane. I don't think, Kate, we have any questions in the Q&A box.
Yeah, we don't have any more. You're correct. So just wanted to make sure we didn't have any additional questions. And of course, wanted to thank everyone for joining us today. And again, you will have the slide presentation and the recording in about a week at the email that you registered with us. So everybody have a great day. Diane, we can't thank you enough for joining us on this. Thank you so much. We appreciate your time. And everyone have a good day. We'll talk to you soon.
Thank you, everyone.
Bye. So long. Farewell.